The registered nurses in the Ontario Nurses Association today are sounding the alarm. We've been sounding the alarm for some time. Not enough nurses, still not enough nurses, cutting patients, cutting care, value the invaluable, more nurses. These are campaigns and stories that I have told over the some 30 plus years that I've had the privilege of working with the Nurses of Ontario. But we need to talk more bluntly, it appears, because our message doesn't seem to be getting through and our patients are suffering as a result. The truth hurts, and nurses know that the unfortunate situations that we're being placed in are impacting the quality of care that we're able to provide our patients. Since January of this year, there has been a total of 625 registered nurses cut, the majority of them being out of the hospitals. They are actual cuts to RN positions across Ontario. That's over 1.2 million hours of registered nursing care. And if we hear, well, we're moving our care into the community, well, the reality is that these positions are not moving into the community for our patients. These are being cut from the hospital system when we've reduced beds, our patients are more acute, complex, and sicker, and we've reduced the highest skilled level of nurses in this province to care for them. And it seems a week doesn't go by where there isn't an announcement from another hospital, and it goes something like this. Due to budget constraints, we are cutting 50 registered nursing jobs, closing 30 beds, but we are transferring the services to the community. And don't worry, patients, your care will be enhanced. We know the truth. Nurses know. I give Ontarians a lot more credit than believing that kind of rhetoric. I don't believe that they believe that their patient care is being improved when services are being cut, when beds are being closed, and the skilled and highly educated registered nursing positions are being deleted. We have the second worst RN to population ratio in this country. We spend the least per capita on healthcare in Canada, and we have the fewest hospital beds per capita. We want to be fiscally responsible with our taxpayers' dollars as well, but not at the expense of our patients. So in summary, we're asking Ontarians to speak up, to talk about the impact that it's having on their patient care. We're asking for them to speak with their MPPs, and even if a small portion of our patients and the public go to our website and sign on to a petition to get the conversation started for this truth hurting and us knowing the results of inappropriate funding in hospitals and the cuts to RNs across Ontario. We need a moratorium on RN cuts, and we need it now. Thank you.